Welcome to this podcast series, which is brought to you by the Young Epilepsy Section of the British Branch of the International League Against Epilepsy.
Hello, Ruth. Welcome.
Hello, Maria. Hi.
Welcome to the first ILAE Yes podcast, and thank you very much for accepting the invitation.
Pleasure.
So we're going to discuss about communication challenges when we manage our epilepsy patients, and in our case, our pediatric epilepsy patients. So I was trying to prepare myself for this podcast, and I was thinking about challenges. And I would say that epilepsy is a condition in which, in the most cases, patients cannot really share the experience of a seizure with others. So in a big majority, seizure is a non-shared experience. And I would like to ask you if you believe that this inability to communicate exactly what happens during the seizure represents a real challenge when we have to communicate with them.
Yes, of course. And children, we see them as young babies when they cannot communicate very much at all apart from their feelings, and then right through to teenagers and adolescents. And so one of the things I think is very interesting is sometimes you follow children over the course of their childhood, and as you get to know them better and they grow up, they are more able to describe their experiences. And there is a developmental element. So at the beginning, they know something's wrong, and they maybe in a focal seizure, they feel very weird and they just can't find the words to describe how they feel. And then as they get older, you can get the feeling of fright or a rising feeling for the abdomen in a temporal lobe seizure or something. They're better able to describe their seizures. But it is one of the challenges, and we rely very heavily, therefore, on witness accounts of seizures and now video recordings of seizures, so that we use a variety of tools to understand the story of individual seizures and the seizure semiology.
Yeah, this is really true, and I like your perspective about the developmental aspect of the description of seizures. Sometimes I get the feeling that many of children, or even more adolescents, feel a bit uncomfortable when we have to describe seizure semiology, or even when I discuss with their carers about what happens during the seizure. So this is a really difficult condition for me.
It is a very challenging condition emotionally for the people affected, and I agree with you. There are many of our patients don't want to see the videos of themselves. Many of the children don't want to be in the room when we're discussing the seizures. They're embarrassed by them, they're frightened of them, and that does represent a challenge in the older children when we're trying to allow them to have more control over their own health and their own condition, and empower them to be interested and look after themselves. And I suppose it's a big issue also with teenagers and dissociative seizures or functional neurological disorders, where we need to get a grasp of what they feel about the condition and how they can help to self-manage the condition.
Do you think that new technology has made communication more difficult or easier? I mean, you already said about the videos and how useful tools they are. And we have now virtual clinics after the pandemic, and in the United Kingdom, specifically, they are here and they still stay. So what do you think? This can make our communication easier in future?
Oh, indeed. And, epilepsy is all about the history, isn't it? And we do need to examine our patients, and we do like to see them face to face and in person to get to know them. But the virtual clinic setting has been a huge development, which happened very quickly in the pandemic. And I don't think we should lose it. It's, in terms of communication, I find that children on the whole are used to talking to each other on screen and through social media. And so talking to a doctor on screen doesn't seem quite so inhibiting or frightening as coming to a hospital and sitting in a clinic, which is a very formal situation. So unexpectedly, some of the teenagers or younger teenagers particularly are just more able to have a chat on screen, which has been really nice, actually. So there are some good things that came out of the pandemic.
Yes, I totally agree. And initially, I found it quite difficult and challenging to do a virtual clinic. However, with time, I find that this is really helpful to bring our care closer to patients. So I have the sense sometimes that we bring epilepsy care into their homes. And also, I feel very lucky sometimes because through virtual clinics, I have the opportunity to have a look at where my patient lives, at their houses, where they play, where their bedroom is, how easy the access is. And especially in younger ages, it is interesting to see how the child is engaged in an environment which is more familiar to them rather than the space in clinical.
Yeah, I agree. I agree, Maria. We get a little peek into somebody else's world, which is very informative. In the early part of my consultant career, I had enough flexibility to visit some of my patients at home, and I always found seeing the families in their own setting immensely valuable. It just underscored the difficulties that they were facing and how they were managing and the adaptations that they had made. And also, as you say, that the conversations, thinking again about communication, can range much more widely in an informal setting. One of the main difficulties I have with the virtual clinics is the time is very, very precise, and the conversation is often very focused, for me, on the epilepsy, the seizures, the medication, and there is less ability for the conversation to just kind of wander into the family's values and what the future might hold and what's important to the child and other aspects of holistic care.
Yes, I think this is significant. And another issue that I would like to raise in our discussion is how easily we communicate with our patients about outcomes and aspects different than seizures, and especially different than seizure control, seizure frequency.
Yes.
And I'm sure there are many aspects which are really important to them, like their sleep quality or their emotional regulation and their academic progress, or even the seizure-free days. I'm not sure that we regularly ask about those aspects. And sometimes even patients or their carers do not bring them up so easily if they are not asked.
No, I agree. And again, I would say that in a face-to-face clinic, those kind of issues are much more likely to come up from the family themselves than they are in a virtual clinic. I was with a family in a regional clinic just the other day when the whole question of a child with a significant genetic neurodisability complicated by epilepsy, and the mum was worried about life expectancy, and would her young child, she's a single mum, what is the chance of him outliving her? Who will look after him as well as she can when she is gone? Because at the moment she's a relatively young mum, but this is obviously a huge worry to her. And when her child was very small and first presented with spasms, let's say, we would have given a very cautious prognosis about epilepsy and learning. We may not really have touched on life expectancy, and there's always this kind of shadow, isn't there, over these families of very vulnerable children. What might happen to them? They might get very sick, they might die in a seizure, there's SUDEP, but we don't talk so much about the children who will survive long term with their disability as care improves, as access to care improves. Children, young people will now be expected to survive well into adulthood and may outlive their families. And I think parents do worry about that. So that's just an example that came up in clinic this week about the worries that parents have, that I don't think I would have heard that if I'd been in a virtual clinic. And it was a comment that she made that we were able to just explore a little bit in a face-to-face clinic because we were allowing the conversation to wander slightly.
Yes, correct. And I'll not forget what the patient had told me a few months ago, an adolescent patient with focal epilepsy, and I had seen her in the context of pre-surgical evaluation. And she had told me, why everyone asks me all the time about seizure frequency and medications and adverse events and all this stuff, but why has no one ever asked me about what's great in my everyday life?
Yes.
So actually, it was a really significant point because great aspects are present every day, but you may not have seizures every day.
Yeah.
So I would say that we may try and incorporate in our clinical practice questions like what worries you most, or what's the most important aspect of your life, or what would you rank as more significant in your disease?
Yeah. And what do you like doing, and what do you enjoy, and those positive things? Because part of the epilepsy stigma is very it's miserable, it's bad news. And actually we know from studies of children with cerebral palsy, for example, and adults, that they rate their own quality of life higher than professionals would expect. And I'm sure that's the same for children and young people with epilepsy. For us, we always see the worst side of it because we see inpatients, we see intensive care. We don't see that these people have lots of stuff that they really enjoy doing. And part of our goal of epilepsy management should be, of course, reducing seizure burden, but actually it's empowering these people to have a full life at school, at home, socially, emotionally, relationships. It's the whole thing, really.
Exactly. Yeah, and those needs change across age. Absolutely. So there are different needs in infancy, different needs in adolescence.
Yeah.
And I think that this makes the process of transition challenging.
Yeah.
As well, and how early and how more effectively we communicate that to patients and families.
Exactly, and we're so good in pediatrics about talking to families all the time, and I know there's some very good models for transition clinics, and ideally you would speak to the child as well as speaking to the family and have time with the child and the teenager on their own. But in the resource limited world in which we function, there isn't the time, sometimes there isn't the space to make that happen easily. So we don't always get to hear what the young person themselves values, and it may not be exactly the same as their parents. It isn't in most families, is it?
Yeah, yes, exactly. And it's really important to engage the adult neurologists as well as early as possible in this journey of transition.
Yes. And also, it will change from country to country and from hospital to hospital. But that comes with its challenges in today's world, just getting two senior physicians in the same room at the same time.
Yeah. And you also mentioned about the genetic progress. And I think this is a real challenge in communication, because sometimes I have the feeling that families are one step ahead of us. They have read a lot.
Yeah.
They have found material which is widely available, and they have higher expectations.
Yeah.
So I think it's getting more and more challenging for clinicians to be up to date with any progress and with any news, so that we can appropriately advise and guide them.
But in a way, that is a challenge, but also it's very lovely that we can mold that into a better partnership with our families. Excuse me. So I can't know everything about every rare disease. I can't know about every genetic abnormality and the implications of that. I don't know what research is going on. Yes, I can Google this and Google that, but the families are experts, particularly with rare diseases. They're such experts in that rare disease. And why shouldn't we tap them for information and help them interpret the information they have and work in a partnership, so that we can do the best we possibly can for that child, that young person?
Yeah, and many changes have been led by parents and carers group as well. So we need to keep their voice as loud as possible.
Yeah, and they're very powerful. We need the parent voice, we need the child voice in planning of research trials, in planning of services. We have to hear that voice.
Mhm. And there is, I mean, do you think that communication is a skill which can be improved and developed throughout our career?
I mean, we all learn, and I'm sure I don't have the same conversations now as I did when I was first a consultant 20 years ago. I mean, how do you think it's best to learn communication, or how should we learn it? What are the positives? What are the negatives? How do we learn things like that? I've done courses, and I've done simulations and acted out, and of course I feel very uncomfortable about acting. But you know, how do I learn? I practice and I practice, but I don't get to watch too many other people having conversations. I'm always really pleased when I can do a joint consultation with perhaps, you know, an ICU colleague or a palliative care colleague or another neurology colleague. I don't know, how do you learn, Maria? How have you developed your communication skills, and what about your colleagues?
Yeah, I think practice is a key factor, to practice as much as possible. My involvement in outpatient clinics has helped me a lot, because I think it gives an early career epileptologist the opportunity to build relationships, to establish relationships with patients and families. So I have found that very useful in my case. And also I have found very useful to join and work with colleagues in multidisciplinary team meetings.
Yes.
Because I mean, I listen to many different opinions, so I'm getting aware of different aspects of my patient's condition, and this knowledge, this awareness helps me when I later go and talk to the family and talk to the child. It's like I know them better.
Yes, yes, and it's really lovely to hear different professional groups phrase things in slightly different ways, use slightly different words. So psychologists, speech and language therapists, when they're talking about problems, difficulties, and support that can be offered and what's likely to happen in the future, it's very, very helpful to kind of be aware of what things they are saying and how they phrase things, because we can incorporate that into our own practice as well and learn from them. So I agree, working in a multidisciplinary team is fantastic.
And also being able to be a good listener, to listen actively. I think this has helped me as well, because first of all, it permits me to have time to think about what I'm listening to, and provide feedback which is more focused on what I have been asked by my patient.
Exactly. I mean, we generally go into some of these conversations kind of knowing what are the information, the list of things that we have to impart, the list of the information that we have to provide. And we also need to listen and be guided by the people we're talking to about the information that they want to hear. And so actually, you know, the active listening and be prompted and allow the conversation to flow according to their agenda is really key.
That's really correct. And in future, I think that communication skills might represent a milestone in ILAE curriculums or different kind of milestones and curriculums throughout the world regarding epilepsy training.
I think so. And we have to remember that one of the most common causes of conflict between healthcare providers and patients and families and their supporters is poor communication, and you know, the consequence of that is conflict and disagreement, and sometimes medico-legal work, litigation. So communication is, you know, massively important, and I think particularly in neurology.
Do you think, or have you ever thought that your communication with patients with epilepsy and their families has changed your way of communication in general?
I don't know. I think it's all mixed up with, I find myself feeling that it's all mixed up with who I am as a person and my relationships outside of work, and also my thinking and my own personal values. You know, I can't take that away from who I am as a professional. So it's all a bit mixed up.
Yeah. I think that in my discussions with patients with epilepsy, I frequently come across issues like control over life, or things that are beyond our control, or uncertainty and fluctuations and flexibility.
Yeah.
So I think they are really useful topics in everyday life as well.
Absolutely.
So from this point of view, I think that my patients have trained me in some way to deal with my own challenges every day in some sense.
Well, I think that's right. I wouldn't be the person I am if I wasn't a consultant neurologist talking with these families and learning from my colleagues, learning from my families, learning from the children that I help to care for. Absolutely. It's a great privilege.
And, yeah, exactly. And as a last question, I would like to ask you, I mean, why did you choose epilepsy as a subspecialty? I mean, what was the reason? What motivated you most?
I think because for me, epilepsy within neurology, you know, you've got the communication aspects, you've got the science aspects, you've got the long-term relationships aspects, you've got different therapeutic strategies, you know, drugs, but surgery, dietary strategies. You know, it's got everything. It's just fascinating. And you know, the brain is a fascinating organ. It's not just a pump, it's not just a tube. It's amazing. It's part of who we all are. So I think epilepsy within neurology has just got everything. And it's very, you know, it's fascinating, and it's got great people working in it, and it's got great science. So it's got everything for me.
Exactly. And I mean, in my case, it was some academic interests I had which pushed me toward this direction. But the more I get involved into this condition, the more I get fascinated by the multiple phases of the disease and how complex it can be. Yeah. And also, I would say that every day I'm really very touched about my patients and how they have to stand stronger after every breakthrough. So I think that this is a really useful lesson for me and makes me want to be in this area and work with them. Yeah, I agree completely. Okay, Ruth, thank you very much. I think we had a really interesting discussion. And thank you very, very much for sharing your experience with us. Thank you for asking me, Maria. It's been a pleasure. Thank you.